My name's Warrant Officer 1, Kaso Steven, and I'm working as the site engineer for the project, which is the upgrade of Mitooma Health Center 4 to General Hospital. First of all, I would like to take this opportunity to thank His Excellency, the President of Uganda, for having entrusted us with these projects, which we are carrying on under the Engineers Brigade team. And the various projects we are doing, we've been carrying them on in various areas. However, I'm tasked to handle the project here in Mitooma district. This project, as you can see it is a big project because its funds it is estimated for 22 billion roughly as an estimate. And the scope, we're doing first of all we phased it out, which we're now doing the OPD. This OPD block is housing the casualty block, the OPD block, and the administration block, which is estimated for 6 million.
I'm so grateful to be an arm of the President in this locality known as the Mitooma district. In Mitooma, sincerely, I'm representing the President with happiness, because it would be a disappointment to deploy me to be the representative of the President, who is regarded as Chief Monitor and Chief Mobilizer, and the person in charge of monitoring of government projects. If I was sent here without resources sent to Mitooma, it would be a great disappointment. But I want to appreciate that sincerely I'm representing the President with happiness because of the resources being poured, not sent but being poured in the Mitooma district. The resources I can talk about is the resources, that is the financial resource that has been sent to Mitooma to construct this General Hospital of Mitooma. It is estimated to be 22.2 billion Uganda shillings by the time we shall complete this project. As per now, we are at 35% of the construction of OPD. OPD means the department of the hospital that will be hosting the patients that come and go. They come to visit and they are examined, there is description and whatever, they have been given medication. This is the department we are constructing. It is at 35% in terms of construction. We are expecting to continue. I think there is a bit of a challenge now as we are ending the financial year. We have not got enough resources at this material time of ending the financial year, but we are expecting more funds because initially we got 6.5 billion to start with. So we are expecting more funds to come.
Then we have other projects like another block which is housing the wards and other structures. We have the staff quarters blocks which we are going to construct. We have other small structures, and then finally we shall do external works on the whole area. So far, when you look at the works done, percentage-wise, we are roughly at around 35%. The level to which we are we are doing the first floor shutters. As you can see, we are doing the decking, and then after we are going to put up the reinforcement so that we can continue up. It is a two-story building. We have a ground floor and we have the first floor.
Tarifa Nachinto, the Chief Administrative Officer of Mitooma District Local Government. This is a project of health center for upgrade to a hospital. So this is a hospital project. It is funded by Government of Uganda. It is the constructors UPDF Engineers Brigade, supervised by Ministry of Health and the district. This is a big project costing over 22 billion shillings. Right now, they are beginning with the general maternity ward. It is also a big building because we have so far dispersed around 6 billion. The workmanship is so good. Actually, the quality of work that the engineering brigade are doing is so good compared to what our local people would do. Our local people would not manage such a project. It is a huge one. The materials that they use, they make their own bricks on site. They use their officers. When you reach at the site is clean. The quality of work is good. You just have to appreciate. Then the officers, the workers that they have are disciplined. They have not disturbed us with the local people around, because there are some contractors, when they bring in workers, you find there are problems in the shop. People are not paying. They've taken people's wives. They've impregnated people's girls. But UPDF have a disciplined team. So as government, we appreciate, and we are looking upon getting more funding to ensure that other structures are also added. But as of now, they are on this administration block, and it is moving on well.
Yes, locally got materials, some are available, but there are some which are, this is a hard to reach area. It's a big challenge around here. It's a very hard to reach area, especially when it has rained. The materials, especially from the quarry, we get them from far as in Tungamo, others as far as in Baraka. So, and it gives us a big challenge for this very place of Mitooma. It is a hard to reach place. As UPDF, I would like to say, first of all, it has been an interesting challenge. At first it was tricky, but we have showcased that we can manage it. Although some people didn't believe in us, some have really believed in us because of the quality and the timely completion of the works.
Yeah, in Mitooma we have quite a number of projects. Mitooma Health Center 4 is being upgraded from Health Center 4 to a general hospital, and we also have Bitereko being elevated from Health Center 3 to Health Center 4. We have another Health Center 3 called Ngoburunga Center 3. Ngoburunga is almost at the border with Congo. It is at the border with the national park. So these projects are also going on very well. Bitereko, in particular, the maternity ward and the theater, those ones are completed and ready for commissioning. Then Kabwohe Health Center 4, so the Mitooma Health Center 4 that is supposed to be elevated to the general hospital, we began with that structure you saw, and it is OPD and administration. We are on the first floor. We are doing the decking and the formwork for the first floor. Now they have started the assembling and fixing the reinforcements, and so very soon we shall start casting the solid slab, the reinforced concrete solid slab for the first floor. It is also on schedule, but the challenge with that project, We don't have all the funding, so it is also going to be done in phases.
At least I have experience of looking at what is being done here and elsewhere. When I compare the workmanship, it is so excellent, and I want to appreciate the UPDF Engineering Brigade for the workmanship that is convincing even the public to say that whatever is done by soldiers these days is regarded to be good. So I'm happy to hear the comments of the people here, and by the way, it is so challenging because it is centrally located in the urban setting. So whoever passes here, they look at what is being done, and you hear comments of the public saying abasajja bakoze, which means the work is good. And I want to thank for the government, not only this site. If we had time, I would have taken you to Rwoburunga, far deep in the Rift Valley. There is a seed secondary school being put up by UPDF Engineering Brigade. If you leave that site, you go nearby there is a maternity ward under Rwoburunga Health Center 3. It is also wonderful. People are saying, hey, Museveni kayatuleetera ebyokutangaza in local language here, that President Museveni has brought wonders, supplying arrangement in their area. You go to Rutoche Town Council, we have put up Health Center 3, and the workmanship there is just a song of the community. Abashaija bombekere irwaro bombekere bayombeka bayo. That is the Nyankore Ruchiga there, that they have put up a wonderful facility. I want to appreciate you. After there, you come to Bitereko. Bitereko, there is a Health Center 3 upgraded to Health Center 4. We have put there, moreover, storage structure of a theater and a maternity. And the people are saying, kandi Museveni akora ebyokutangaza hati nakalina yagireeta omu byaro eyirwaro. It is there. The workmanship is so excellent, and they are now renovating the old structures. They are putting up more staff quarters. The work is so good to me, and even those who come, by the way, there is no person who comes to monitor or to supervise and challenge. They just say, kandi banu bakaba bari nkaba kwombeka je, meaning the UPDF came late, too late, they would have been here earlier on.
Seen in Ambole, you have seen in Entebbe International Airport, you have seen all these very many projects scattered all over the country. Now, assuming it is one mega project in one location, if you can manage all those projects scattered all over the country, moreover, some of them are deep in remote areas, you saw yourself, and others who were there. So we have the capacity to manage these projects. We have the personnel, we have some equipment, all we need is support for more equipment, and then we are good to go. These projects, all these big projects we are talking about, dams, standard gauge railway, roads, you give them to us and see, we shall do them. We shall do them as long as there is proper documentation of that project. There is a design, the BOQs are there, the drawings are there, and there is money, and you can do these projects. What the government of Uganda can do, if it is a complex project, is just to give us a consultant. Like we have been working with the consultants. All these big projects, once you have a consultant, you have the project implementation team, project management team in place, then all these projects can be done. There's nothing that can't be done. Moreover, these countries you are talking about, who did their projects? It's them, they did their own projects. So why are you comfortable with them doing our own projects? Why don't you want us Ugandans to do our own projects? Let's also do our own projects and we save money for our country. We need a lot of money for other developments. Yes, when we are doing any construction, the monitoring and evaluation team and the supervision teams are always available. Every month there are site meetings and site inspections on every project in the country. If it is local government, the local government team will do the supervision and the monitoring. If it is Ministry of Health will do the supervision and monitoring. UCA, OPM, because we have also handled projects under the Office of the Prime Minister, Internal Affairs, ICT, Ministry of ICT. All these, they have a mechanism of supervising their projects. And I think we are the best people to supervise, because the soldiers adhere, they listen to orders very well. You find it very easy to give an instruction and it is executed before the next meeting, other than when you are using the other people, because I also know very well that the other contractors, you can give them an instruction, you come back for the next inspection, you find the first instruction you left behind was not executed. But with us, you give us an instruction, before the next inspection, that instruction would have been executed. Yes, so we are monitored, we are supervised, and everything is moving on very well.
Obviously, the ones that we had were very old, they were small, they would not manage. But now this one is going to manage a huge number, and we hope that even people from neighboring districts will benefit from this hospital. People from districts like Shema, the ones we board with, Rukunjiri and the like, the capacity is big. This one is general. It has a theater, it has a inpatient department, it has maternity, it has a number of units that it's going to handle. From our contractors that we had, actually I think it was a blessing that the president looked upon Engineering Brigade coming upon to do this work. We've had a number of projects that are abandoned by contractors. Someone begins work, they have no capacity, they have no, they don't have enough maybe workmanship, and you find they abandon projects. But UPDF is on site. Whether we've given them resources or not, they are working. Meaning that they are sure that they will get the funding. Like we had an engagement with their bosses, and they told us that the 1.5 billion that we gave them is almost utilized already. But works are still ongoing, meaning that as we bring in more funds, we shall be reimbursing. But if it was a local contractor, they would abandon the site. So this is an advantage to government.
Most of the buildings we're going to do, they are 2 stories. However, we decided to start with this one because there's no enough space. We find that there are also existing structures which we didn't want to remove, having found out that they are being in use. That's why we decided to start with this one, and we shall be working in phases. Maybe if I could talk about the challenges so far faced around. Ever since we started, we've not faced much bigger challenges. Work we've been moving on well, apart from the natural challenges like the heavy rains, and these ones affected us much in the substructure, which actually caused us some delay in the substructure because we could not effectively get enough time to over. Then another challenge maybe is the material. When we started, we tried to move around to look for the best material, better material, which we couldn't get nearby. So we decided to travel and go. We're getting our material from Rubaya, that is Mbara, which is a bit far, and now it affects us in transporting the material, and even the road, the access road to the quarry is not all that good. So those are the few challenges so far we've been facing around. Thank you so much. I remain Warrant Officer 1 HCIII, the site engineer.
I'm Dr. Taremwa Julius, a medical officer, a public health specialist at Mitooma Health Center 4 and also the health facility in charge for Mitooma Health Center 4. I want to thank the government of Uganda for the expansion of Mitooma Health Center 4 and upgrading it to Mitooma District Hospital. This expansion is very important for our population in this community, where we've been having a challenge of many patients flogging the health center 4 with limited capacity in terms of human resource and in terms of structures, in terms of equipment as a health center 4. Now with this expansion, we'll be able to attract all these cadres into the health facility. With the brigade, we have been having a good relation. In the social hour, we play football together with the boys of the brigade. We spend the social times together, which has also beefed up the security of our environment. With the engineering brigade or UPDF Engineering Brigade, some of the wrongdoers that would previously affect or penetrate our health facility are scared or have fled because of the presence of the engineering brigade in the health facility. This is a good thing that we really appreciate the government of Uganda to bring the UPDF brigade and the construction process into this health facility.
Yes, I want to thank the UPDF leadership. I want to thank the President for entrusting UPDF with these projects. More so, I want to thank the leadership of Mitooma for these very projects. They have been very cooperative. When we have a problem, we reach them and they help us. But I want to thank the leadership of UPDF for entrusting Engineering Brigade with these projects. We have not let them down. We on the ground are doing quality work. So we want to send a positive picture of UPDF out there.
Engineers Brigade is ready to undertake all the projects in the country, even those not within the directive of the President. I call on all MDAs to give us projects, moreover very big projects, so that we are able to realize savings for our country. Once we save money, then that money can be used for the socio-economic transformation of our country. I want to thank different ministries, departments and agencies which have given us jobs. Office of the Prime Minister, in particular the Right Honorable Prime Minister of Uganda. We have 9 projects there. Now the last one is Rukochi, and she was the one in the lead to make sure that Engineers Brigade undertakes those projects. So out of the 9 projects that were given under the Office of the Prime Minister, 8 are completed, and also Rukochi in Kasese is under completion. I want to thank the Ministry of Health, the Honorable Minister, the PS, and their teams, because ever since we started working with them, we have not had any challenges. We work together as a team. You might not even know that this engineer from his Engineers Brigade or from Ministry of Health, because it is government to government. The project is for the government of Uganda, Ministry of Health is working for government of Uganda, Engineers Brigade working for the government of Uganda, so we work as one team, and it has helped us to move work very quickly and produce quality work. I want to thank Ministry of Education and Sports. They have given us quite a number of projects, including Nambole, which was recently tested. We had 2 games played from there, and the feedback is okay. People are very happy with what they saw, and so we want to thank them. Also, the cooperation has and is very good. We want to thank UCIII. They have given us also 7 projects so far. They are giving us more for. And I can assure them that even the other ones they have given us shall be executed. We want to thank the Ministry of Local Government. When we were starting, everybody was worried. I was also worried about the Ministry of Local Government, because Ministry of Local Government, there are quite very many districts and different regions. But I can tell you that local government has been the best to work with. They really understand quickly what we want. Once we agree on what to do, then they have been telling me that their role of monitoring and evaluation has been simplified. Others tell me that once the money is with the Engineers Brigade, then it is very safe, that they know that quality work will be produced and that will be produced in time. And so I want to thank them for their level of cooperation and for the guidance they give us. Internal affairs, even the Catholic Church, they gave us Bukarango. There is a church called Bukarango in Wakiso. We are doing that church, so also want to thank them. ICT and very many other departments. All we can promise is that we shall do a very good job.
Karibu